that. What I want to do today is just kind of talk with you a little bit about our program, tell you about it, and then if you're interested, Renee has my contact information, or you can email me at markhoyal, MarkHoyal, at sdch.com. That's as in South Davis Community Hospital. We love you guys. We hire a lot of you guys, and we've got a great program. Do we have any questions? I know this sounds funny to be kind of on the TV and doing this like this. I honestly, COVID's kind of messed everything up. But questions, anything I can try to answer about the program? You will be working as a real nurse. You're not a super aide or a super CNA. You'll be running your teams, doing wound care, med passes, everything that you'd be doing as a nurse. Any questions?
Let me
have that pause, right?
Let me just insert here, Mark. This is Vicki, the instructor. So
hello.
I was just going to add my 2 cents here that this opportunity is really great. The thing that I love about South Davis is that you get to utilize all your skills there. They have so many different types of patients. They have LTAC there. They have pediatric patients. They have long-term care skilled nursing facilities. They have all different kinds of patients. You literally will utilize everything that you have learned, which always makes you a stronger nurse when you finish and go on to get your RN. So it helps to utilize this, that they're willing to work with you. It's just something that I strongly would encourage you to consider, at least if you're going to continue to work. Some of you will need to continue to work, and I just got to tell you, the difference in pay between an LPN and a CNA is phenomenal. You'll love it at that first paycheck. So I'm just throwing in my 2 cents there for you, Mark.
Well, thank you. And one of these questions, are there limited units LPN can work at? No, you'll work. We've got our 2 pediatric units. We've got our 2 adult units. You can work on the LTAC unit as well, which is basically like our step-down ICU. And let's see. Oh, good. Leslie has asked the most important question. We start you guys at $19 an hour. Then once you're IV certified, you get an extra $1 an hour on top of that. And then there are also differentials on top of that, whether you're working the afternoon, the night shift, and then on weekends as well. So good question. What other questions do we got? This is sort of fun. Let's see. We've tacked pay. We've tacked shifts. Any other questions that I can answer? We are in Bountiful, and I do have about 6 spots that we can hold, because we basically have to rearrange our entire nursing template to work around you guys as students, which we're very happy to do. The other question that usually comes up is you can work as much as you want. 16 hours a week is the minimums. Again, that would be your 1 shift during the school week, and then every other weekend. A lot of the students work full-time in the summer times. That's totally your prerogative if you'd like to. Lots of options. Any other questions?
Hi, Mark. It's Megan.
Megan, hey, how's it going?
Good. How are you?
I'm doing very, very well.
I'll throw my 2 cents in.
Thank you, Megan. I appreciate that.
I work at South Davis, for anyone who is on this, and I love South Davis. And it's a really good place to work. There's a lot, like, we use all of our skills, and even just working as a CNA, all the nurses will be like, oh, baby nurse, come on, let's go do this. And so it's like already been a good place even as a student to work. And it's a good place because it's not crazy. Like, I know at clinicals when we go and the teams are like out of control and you have 1 million patients in no time. Like, the teams are normal set. You have your own CNA to your own team. So like, patients are getting taken care of. It's great. I love it. And the call-in pay is good.
Yes, that's another awesome factor as well. But yeah, so where can we apply? I'm gonna put in my email address, and you can just send me an email if you'd like, or you can go to www.sdch.com, and you can just apply for an LPN position. we know that your schedules are not necessarily set, and that's totally fine. What we want to do over the next couple of weeks is basically just find out who's interested. And then those of you that are interested, we'll get you down for an interview. We can go over a few things and just talk about what some of those options look like. The cool thing about this is, and this happens every year, because if you think about it now, let's fast forward to our RN year. As we start working as a nurse, most of the people that you're going to be precepting with, they're used to be with being with CNAs. And every year we always have one of our LPNs that knows how to do something during your preception, if that makes sense. So you're there with your nurse, something comes up and you know more how to do something. And it's because you've actually been working as a nurse. And everybody who's gone through this particular program has said that it's made their RN year easier. So that's basically what we've got. I will send you guys my contact information. You do not need to have your LPN license to apply. We know that you're still in the process, and we work around that. We know that as you're graduating, you probably realistically may not even have your license until the first couple of weeks of January, which is fine. We're just sort of getting the word out there to see if you're interested. Good. These are all great questions. Yes, and we understand that it's scheduled out, and that's fine. We're just looking to hold some spots and see who's interested. That was Megan who asked that question, but you guys can probably kind of tell that because we're all in the same chat feed, so I apologize. I kind of feel like Vince Vaughn from The Intern, you know what I mean? So, yeah, any other questions? I thank you, Miss Vicky, for letting me take some time this morning with your students, and Megan for the awesome plug. Any other questions? All right, so watch for, I'm going to type in the general email address that you can apply to, or I'll even send you mine as well. Here we go. So it's www. Okay, thank you. Okay.
There we go.
So it's www. Oh, that's fine. MARK HOYAL at sdch.com.
Did I get it right?
That's perfect. And then will you also do www.sdch.com? And you can apply. And then thank you guys very, Miss Vicky. It's good to see you again. It's weird to do this. I wish it's just the new norm is to get on TV and talk about.
We're cyber tech savvy here. We handle every situation.
I love it. I love
okay.
it. Well, thank you guys. And if you guys have honestly any questions, let me put my phone number on there as well. Is that all right? If they want to call and or whatever.
Yeah.
801-397-8186.
Got it?
Perfect. That's the one. All right. Thank you guys. Have a great rest of your morning. Appreciate your time. Okay. Thanks.
Oh, whoa, geez, Louise, that'll get you, isn't it? That's a little bit big for me. Except where did my little PowerPoint go? This is what I love about this kind of stuff is that I lose it all the time. Where did my presentation go? Let's see. Hold on. Okay, let me tell you what's happening today. First of all, it looks like we still have a couple of students that need to take the test, but it looks like there will be one question thrown out. Let's see. I don't want to upload that. I want this presentation. I close. And where is it? Where did it go? My presentation, I've lost it. It's still there, but I can't find it. I just love this stuff. Let me. All right, people. I got Mark's presentation all ready to go. What the heck? Try this sharing the screen. See what happens here. Application window. All right. Okay, let's go back. Why does this? You guys, the good news is we only have one more day of this. Yes, we do. We have only one more day of this stupid big blue button. Yay! They think they use Zoom over at Weber. And why do you care about that? Because all of you are going on to Weber. Yes, you are. I'm just going to encourage you. Just say, just stay in. So we do not have class tomorrow? Oh, yes, you do. Tomorrow, yes, you do. You have 2 hours. Today we're doing HIV. Tomorrow we're doing cancer. And then after my fabulous little 2-hour lecture, I'm sorry, I barely can think about these things. Sorry, I have to do this. Upload a presentation, do this, bring this over to here. Oh my gosh. I can't think of 2 things at once. Let me just. Okay, and then we're going to enable editing, and then we're going to put that there, and then we've got this confirmed, and we've got this to where we're going to share the screen, and we're going to do the application window. The immune system right here. There. See if it works. Maybe. Where did it go? Come back. Come back, little person. Okay. Can everybody see that? Give me a shout out because I can't see the comments.
So it's only showing half of the screen like it did last week with the presentations.
Oh, I just love that. Don't you? Let's get out of here then. Okay. Woo! Maybe we got this. Let's see. Can everybody see it?
Yeah, we can.
Okay.
Good.
All right. So, oh, thank goodness. All right. So let's go back to the exam. For all intents and purposes, we still have a couple of people that need to take the exam. But from the statistics that I saw this morning, first of all, you did the best on this ever. I think the average was 83%, but that was before one question is thrown out. There is one question that is thrown out. Actually, all the statistics were very good, but there was one question thrown out about I'm not going to talk about it because there's a couple of people that still haven't taken the test. So you can kind of gauge your grade from there. And as soon as those 2 people take the test, then we'll put out a definitive text about that. As I said, we have 2 hours of lecture today, now a little bit less than 2 hours. This is on HIV, and Mark Medina has a student presentation for us. And then tomorrow we will have from 8 to 10 a 2-hour lecture on cancer. And then after that, there will be a psych review and an OB review. Usually those reviews are given to help prepare you just because it's been so long since you've had those lectures that kind of reviews information for you that you'll want to pay attention to. The test for this week's lectures will be next Monday. I will do a review for that exam on Wednesday and get that uploaded for you. And then, oh my gosh, people, hold it, hold it. You're done. Yeah, you're done. You do have a final to take. I will tell you that there will be an adult final, and then there will be a peds final. They're two separate finals. Each final has 100 questions on it. So you'll take one day, and you'll take the peds one following my adult one. And there's no review for it. You say, what? What do you mean there's no review for the final? Well, there's no review for the final. And why? It's because there's nothing new. Yeah, nothing. It's all information that you have had before. It's, and what I would strongly encourage you to do is go back and look at your exams. For those exams that you did well on, be sure to just not spend a lot of time studying, but read through those notes rather quickly to bring everything to the forefront, and then spend more time on those exams that you didn't do so well on, or if you feel like you could have studied a little bit more for, or if you need any clarification, I'm happy to answer any specific questions for you about the material. But there's nothing new. If you have been studying your little hearts out, which I know you have, I can almost get emotional about this because you guys have been through the entire nursing program in the pandemic, during the time of the pandemic. It has been so stressful. It has been so hard. It is, the pressure has been so intense for so long. And it's just beyond belief what you've accomplished. You have accomplished what I have been teaching for 17 years. I have never seen any class handle the stress that you all have been put under in the last 9 months. And so I highly commend you that you're still standing. You guys may not be at the level you want to be, but you know what? You're still standing. You're still standing, and that's all that matters. Nobody is ever going to ask you, hey, when'd you make a nursing school? Because you know what? They know you've got your licensures. They see the credentials. You're gonna be okay, people. You're gonna be okay. And let me just snort and move on. So anyway, so the final is going to be 100 questions, and like I said, there is no specific review for it. Again, don't spend a lot of time on stuff that you already know. Spend time on stuff that you don't know, or you want to clarify a little bit and get it up and going. That being said, that after you pass, because you will, and after you've been to pinning, you better come, then you'll go on and set your NCLEX date. This is when I know Chantel encouraged you all to get an app early. This is when I say start looking at that app. And usually when I first taught at Weber, I taught the NCLEX prep class for the RN licensure. And we encourage those students to take 2,000 to 5,000 questions, practice questions, in preparation for the exam. And that's really what you get down to, is practicing taking questions. The material you know, you don't need to know. You need to, when you look at those prep questions, they give you the rationale why the answer is correct, that is correct. And if you don't get it correctly, if you don't choose the correct answer, you need to understand why they're choosing the answer they do. And this is where your strategy for test taking comes in. So don't think you've got it made in the shade. You've got 3 whole weeks of vacation there. And you'll be prepping for the RN program, and they start fast and furious. First 3 weeks are labs and all new skills and all new pass-offs and everything else. So your work is not over, but you have had a it's the Rona. I'm just snotty. But you have made a monumental step. And I have to tell you from experience that there is nothing comparable to this when you pass this class, because not necessarily this class, but when you pass a nursing program, because you earned it. Nobody took it from you. You withstood all the pressure, all the exceptions, all the frequent changes, all the adaptations. You did it. Nobody can ever take that from you. And it will give you a level of confidence that you will probably never get again, because you know what you've done. And as you start off in your career, you'll get experiences and you'll get better and better and better. And maybe by the end of 10 years, you will have a similar confidence. But the confidence that you have in yourself and what you can achieve has come through what you've accomplished over the last 9 months. Okay, so we're moving on. Okay, I'm done with that. We're done. Okay, we're done. We're moving on to the immune system here. And so we're talking about two different things here. We're talking about HIV and we're talking about cancer. And today we're going to limit it to HIV. And so I have to get my second computer going here so I can read. I need to read. Okay, here is the objectives that we're going to be looking at today. Recognize the role of the nurse in educating the public about the prevention of HIV infections. Identify clinical manifestations experienced by patients with AIDS. Describe the current methods of treatment of HIV infection. Identify best practice for patient safety and quality of care of the hospitalized immunosuppressed patient. Identify important nursing care measures for HIV patients, their families, and significant others, and discuss the problem of HIV transmission to healthcare workers. Okay, so I think this is very interesting that we're talking about HIV today, because this occurred back in the 80s. It first was reported back in the early 80s, and I'm telling you, the Rona is so similar to this, because first of all, when it first hit, we didn't know anything about it. We just knew that there was a huge number of people dying all of a sudden, mainly in the homosexual community. And we had no idea what was going on. We didn't know what was causing them to die. It was very short-lived. It was pretty scary. And the thing about it is that it's happened the same way with the Rona. We sat there and we didn't know what was going on. We didn't know how it was transmitted. We guessed how it was transmitted. We tried doing certain things. And you got to remember, back in the 80s, there was no such thing as universal precautions. What? I'm through with my Diet Coke already. I've been sucking it all morning long. Excuse me while I get this ready. So, back in the 80s, yeah, it was cool to walk down the corridor of a hospital with blood on your shirt. Why? Because it meant that you were important, that you had saved a life. That you were really, really good, and you washed your hands, and that was about it. And you only wore gloves in the operating room. Well, things have all changed since then. When we didn't know what was causing the transmission, then we started wearing gloves. And so all of a sudden, we could wear gloves, but we didn't know, should we wear a mask too? We didn't know how it was transmitted. It was very, very scary. And so the thing about it is that it just went crazy. The numbers for HIV are very similar to the numbers that you hear about today. However, it wasn't considered a pandemic. We didn't know that it was a pandemic. We didn't know what was going on in Africa. We didn't know where it was going on. We just didn't know. And it's the same thing that has happened with the corona. We didn't know We did know that it started in China, but we didn't know how bad it was going to get in Italy. We didn't know how it was transmitted. You know, it was being brought in from other visitors. We didn't know any of that type of stuff. And so it was a very scary time. But because the homosexual community was very, and has always been, very embraced by the celebrity culture, then Hollywood kind of took on its mission to try and do fundraisers and all kinds of things to get the funding necessary to research this disease and find out what was going on. It has turned out that HIV was an immune deficiency disease. They did know that the immune system was being affected. They did know that all of a sudden these young people were being subject to diseases that most of the country was protected against. They didn't know why some of these individuals were developing things like TB. TB had come and gone. It was pretty much under control, but now these young people were getting TB, other kinds of infections. So it was kind of a scary time, and it was, and because the predominant number of people that were being affected were from the homosexual community, then you had moral issues that were involved. The super hyper-religious communities were damning these people, so to speak, for being immoral. It was awful. It was an awful time in the United States, and how sad it was that for many of the people that had experienced this disease and were going through this disease, and the isolation that they encountered, and was very, very, very difficult and depressing for them. But we have since found that this is a pandemic. It's everywhere. And again, it's the most common immune deficiency disease in the world. And new HIV infections are more commonly found among African Americans than they are Caucasians. And only about 25% of the people that get HIV are women. But usually they get that from their infected partners. 11% of the new infections are those people that are age 50 and older. Now, why do you think, especially here in the United States, that the highest growing number of people getting HIV are over the age of 50? No. What else are you going to do at a nursing home? No, I'm just kidding. It's true. I mean, you got to do something in nursing homes, right? No, it's because they sit there and they don't use condoms because the women can't get pregnant. Yeah. So they sit there and they just have unprotected sex in nursing homes. Did you know that you can have sex in nursing homes? Yeah, they'll allow rooms for it. I've been told, I've heard, haven't experienced it myself, but I'm just saying. So the thing about it is it is a fun fact, Aslan. So everyone who has AIDS has an HIV infection, but not everyone who has an HIV infection has AIDS. So AIDS develops. AIDS is a progressed form of HIV, and we'll talk about that in a little bit later. And so the thing about it is that a lot of times, and we're going to talk about how you acquire HIV and the incubation time and all that kind of stuff. And it's much like the Rona, in that you may be symptomatic and you may be asymptomatic and are carrying the disease and pass it along to others without knowing. So it's very insidious in that aspect. Okay, so here's what is so interesting to me. You'll see here that is depiction of people that have HIV and the colors, and the darker the color of red or orange, whatever you want to say, is the more prevalent the disease is. Now look at here. Africa, of course, has got the highest incidence and prevalence of HIV, but look at the United States of America. One of the most smartest nations in the world, question mark, question mark. South America as well. Yeah, next to Africa, they have the highest incidence and prevalence of AIDS in the world. In the world! Kind of scary, isn't it? Right now, there's 1.8 million children worldwide that are being affected by the AIDS. And again, that's usually comes from Africa because, number one, they don't have a medical system there and they don't have access to health care in Africa as we do here in the United States. But so consequently, mothers are infected and pass it along to their unborn children. Okay. Let me just move along here with my other little thing here. All right, so the World Health Organization has some alarming statistics. First of all, as I said earlier, gay and bisexual men of all races are usually the ones that are most severely affected by this disease. And the thing about it is that 1 in 6 people are living with AIDS, AIDS with HIV. And the thing about it is that is so scary. 1 of these people out of the 6 that have HIV is totally unaware that they have it. And this is where passing it along and transmission gets to be so problematic, as we have seen with the coronavirus. People that are carrying it don't know they have it, go out in public, go to their families, go to their parents, go wherever, pass it along, and they're totally unaware that they were the one that was carrying the virus. And so that is what is scary about HIV. And if you will look over here, that there's recommended screening for the ages of 13 to 24 is the age where the transmission seems to be the highest. And so you think of little 13-year-olds that are having sex. Let's think about that for a minute. No, too long. Can't think of it. So, but they are so ignorant of what they are doing. They're just little rabbits, bless their hearts. They're just getting off. That's all they're worried about, is getting off. And so they are not thinking along about transmitting any diseases or having protected sex or any of that kind of stuff. No, they're not. They're not. And so this is where it becomes very dangerous at that age. And you know, do they just have one? Are they monogamous at the age of 13? No, they're not. I'm just saying from personal experience that they're not. I'm going on without responding to my own comment. So the thing about it is that the transmission can just, boom, just explode, just like it has with the coronavirus, just like the coronavirus. So you can get some idea of how problematic the spread of this disease has become. So, all right, the good news that, and this is the sad thing, was back in the day, back in the 80s when we didn't know what was going on, these people were dying in droves and droves and droves. Just, you know, because we had no idea what the cause was or how to stop it. But today, and if you were ever diagnosed with HIV, pretty much it was a death sentence. It was, you were going to progress into AIDS, and it was over because there was no cure for it. There is still no cure for it, but it is no longer characterized as a life-ending illness. So it is with ARV. ARV stands for antiretroviral therapy. Now, we say, okay, why do they call it antiretroviral therapy? It's because HIV is a retrovirus. In other words, it only has ribonucleic acid as its DNA, as its genetic material. And so it's called a retrovirus. Well, now the therapy that we use is antiretroviral therapy. So it addresses interrupting that are in a genetic material, so it doesn't continue to proliferate within a person's immune system. So HIV disease is a chronic, sometimes progressive immune disorder. And like I said earlier, the majority of AIDS patients in the United States are over the age of 50. And what happens with people that are older that contract HIV is that the compromised immune system speeds up the aging process, and so they will develop the aging diseases a lot faster, cardiovascular diseases and other diseases that are associated with aging. So how does this happen exactly? So the thing about it is that CD4 T cells are the white cells that the human body produces that kind of direct the immune system defenses. They kind of regulate all the other white blood cells and where they go and what they need to do, and all the little immune responses. So what happens with HIV is that the virus itself will attack the CD4 T cells, and it will make copies of itself. Now you have no one leading the normal white blood cells in the body, telling them what to do, and so basically you have immune system failure. And so this is the progression of the disease process itself. So what happens is that the virus itself will target the CD4 T cell, and it'll attach to the cell, and then a little probe will break through the cell wall, and it releases an enzyme into the nucleus of the T cell. And then this kind of virus will start to replicate. And then as it converts that T cell into the virus, then it'll go back out of the T cell and it'll start attacking other T cells. And so when there is a CD4 T cell count of less than 200,000 per milliliter of blood, then the patient is said to have HIV. Okay, actually he's not said to have HIV, he's said to have AIDS, but there's one other stipulating factor that we're going to talk about in a minute to say that they have AIDS. But when you have less than 200,000 of the CD4 T cells, then your immune system is extremely compromised. And you already have HIV. Okay, so here is how insidious the transmission is for HIV. First of all, that there is an incubation period of 2 to 4 weeks. Now we know that with the Rona, don't we? That there's 4 or 5 days incubation period. We have it. We don't know we have it. The same thing with HIV. There can be an incubation period of 2 to 4 weeks. And at that time, if you were to go in and get tested, then the test may come back negative. because those antibodies are not present in the blood yet. And so then some, but not all people, will start to experience flu-like symptoms. And you want to put a star by this little bullet hole right here, because some, but not all, will experience flu-like symptoms. And that flu will last 2 to 3 weeks. And that same holds true for the Rona as well, is that once you start experiencing symptoms, then it may last for a couple of weeks. And that's why they want you to quarantine for 2 weeks. Some individuals will remain symptom-free for 10 years. And so you have these little HIV, and we don't know why the virus gets in, but doesn't really go into the CD4 T cells. Don't know yet. Still don't know. But the thing that you have to worry about is that the HIV can be, even though you're symptom-free, it's latent in there, you have the HIV, you may go and get tested positive, but you still don't have any signs or symptoms. But we do know that it is multiplying, but for whatever reason, the immune system is still holding on. Still a lot of research that has to be done on this. So again, here's just a continuum of the disease here. And again, look at this number. Sometimes we read 200,000 per milliliter of CD4 T cells. It is the strategic number. Sometimes it's written less than 200 cells per cubic millimeter. So it can be written either way, either 200,000 per milliliter of blood or less than 200 cells per cubic millimeter. Okay, so either or is a way that you can see that golden number where a person is said to be severely immune compromised and is very susceptible for developing AIDS. So and here's that number right there again that you're looking at. So when the CD4 T cell count gets to be less than 200 cells per cubic millimeter, and the individual has one or more opportunistic infections, the individual is considered to have AIDS. So remember, this number is where the immune system starts to be severely compromised. But in order to have AIDS, then the person has to have one or more opportunistic infections. So you ask yourself, so what's an opportunistic infection? An opportunistic infection is a virus, a disease, it's a pathogen that under normal circumstances and someone with a working, functioning immune system will be able to be exposed to that pathogen, and the immune system will gobble it up. T cells will come in and just eat up that pathogen, and the person will never get sick. But when a person's immune system is so compromised that that same pathogen enters their body, then there is no immune system to fight off that pathogen, and that pathogen will develop into a full-blown illness. So that's an opportunistic infection, and there's several of them that are specific to AIDS that we're going to talk about here in just a minute. But you need to recognize that for the definition of AIDS, you not only have a very low immune system or CD4 T cell count, but you also have one or more opportunistic infections. And then that is the definition of AIDS. So you have to have both those factors to be considered as having AIDS. All right. So before we go on here, let's look and see how the HIV is transmitted. First of all, it's not transmitted by sweat, tears, urine, feces, or kissing. It is transmitted through any product that has blood in it. It can also have comes through breast milk and any body fluids that contain blood. So there are 3 ways that it can be transmitted. Actually, there's about 6 ways. So we're going to talk about it, but we're going to talk mainly about the sexual, parenteral, and perinatal way of being transmitted. But as you can see, there's occupational exposure. Whoa! What are we talking about there? We're talking about healthcare workers. And then we can talk about blood transfusions as well, which has become so very, very rare because blood is tested over and over and over again. So when we're talking about sexual transmission here, sexual content, do I continue and go on to this? Yes, I do. So sexually, they have given out the advice for ABCs. First of all, abstinence is the only way that's going to guarantee that you're not going to get AIDS, literally. And so A, that stands for A. B stands for be faithful. So be monogamous. You don't have multiple sexual partners. And C, you always use condoms. So the thing about it is that one thing that was very insidious about HIV is that back in the 80s, you know, we were just coming off the 60s and the 70s. Yeah, those were the days, people. Free love, drugs, rock and roll. So there was a lot of sex going on, but there's a lot of sex going on today. I'm just saying. So I've heard. I'm just saying. Anyway, so the thing about it is that if HIV was transmitted and if someone was asymptomatic, didn't know that whoever they had slept with had HIV, they may go and sleep with somebody else. So basically, the way you had to look at this was that you weren't just sleeping with their partner or with whoever you woke up with in the morning, say. Then you've also slept with everybody that they've slept with, because people were not getting checked very frequently. It's a lot more common. It's a lot more acceptable today that this can be transmitted. And so, people are are having, I've heard, I don't know, are having sex do get checked a lot more frequently for HIV. But back in the 80s, it wasn't. And so the CDC recommends the ABCs, abstinence, being faithful, and using condoms as far as sexual transmission is concerned. Men having anal sex usually are a lot more prone to transmitting the disease because of sometimes anal tears in the mucosa because of their sex that they're having, wild and woolly sex. All right, so another way that HIV can be transmitted was parenterally or through needles, use needles. And this is when needle protection became, that you don't use the same needle. You always change out needle. And it became such a problem that pharmacies started offering to switch out needles. You bring me a dirty needle, I'll give you a clean needle. And so there were needle exchange programs hoping that the transmission of HIV would be stemmed somewhat by that. But, you know, when you think of people that use parenteral drugs or drugs that have to be shot up through the arm or through a vein, do they care? Do they really care? Do they? I'm just throwing that out there. Do they really care? You know, I can't think that they do. When you are so intent on getting that drug and the addiction is so severe that that's all you think about and forwards on, you're not really going to think about going in and getting a clean needle. So it will be a clean shot of heroin that you're putting in your arm. No, it's not. But this is things that we tried to do to try and stem the transmission of HIV. So the thing about it is that they've come up with, the CDC has done some recommendations where they boil the syringe and the needle, or they can clean the syringe and needle by flushing with clear water. And then filling it with household bleach and shake for 30 to 60 minutes. Now, do you think or 30 to 60 seconds? You think that they're going to do that if they're not going to walk into a pharmacy and switch out their needle? Do you think they're going to take the time to do that? If they got heroin in their pocket, do you think they're going to postpone putting it into their arm or between their toes? Just saying. So has this been effective? No, but it's things that the government was trying to do to prevent the transmission of HIV. So, and then the third way that transmission was very prevalent was through transferring it from mother to unborn child. So the thing about it is that in Africa, like I said, it is just a huge problem where there is no access to health care. But here in the United States, if you have prenatal care and if you have, the mother is on drug therapy, and then when the baby is born, the baby stays on the medication for another 6 weeks, the child actually has less than 1% chance of acquiring HIV. So it's highly, highly effective. But again, the mother needs to have prenatal care and have access to that care during the pregnancy for it to be effective. Now, I'm sure that you have seen on TV the commercials for Truvada, which I have to just smile because, oh my gosh, back in the 80s, would this have been, I mean, we didn't even see women in their bras yet. I can remember when Playtex gave the first bra commercial on TV. It was like huge. It just made the lightning. You knew that they were showing a woman in a bra. And now they're talking about PrEP, which is pre-exposure prophylactics medication you take so that you don't acquire HIV. We've come a long way, haven't we? But PrEP, and you need to recognize the difference between PrEP and PEP. PEP is post-exposure, but PrEP, P-R, pre-exposure prophylaxis, is hair medication that you can take. They have people that don't have HIV yet, but maybe they're sleeping with multiple partners and have a substantial risk of getting HIV. Then this will help them from getting it. So Truvada and TAF. TAF has fewer renal and bone side effects than Truvada has, but Truvada is more widely known. So, again, how do we diagnose somebody that has HIV? First of all, we talked about the screening between the ages of 13 and 65 years of age. Did I tell you one time that I went to the hospital and I was 60 and I had to have some emergency surgery done, nothing major, but I had to have it done and it had to be done right away. And I was 60 years old and she asked me if I was pregnant. I just looked at her like, are you screwing with me? I just looked at her and I said, no. And she said, I'm not pregnant. And she said, well, we have to ask anybody between the ages of 9 and 65 if they're pregnant. We ask anybody between that is older than the age of 8 if they smoke. And we ask anybody older than the age of 9 if they're having sex. Oh, I guess people are having more fun than I am. I'm just saying. But screening, 13 to 65 years of age, and do they have sex? Are they? And you know, the thing about it is, I hate to say the word promiscuous, mainly because I can't spell it, but I hate to say it because it's so common. It doesn't mean you're promiscuous. It just means that this is a sign of the times. This is, you know, you do have multiple partners, and it's just kind of, from what I've heard, the end of a good date. Yeah, that's what I've heard. I don't know. But anyway, so do you practice those risk behaviors, which could be any one of the 3 types of things that we talked about? The multiple sex partners, if we use needles, or if you're pregnant and have HIV. So, do they do IV drug use? Do they have a partner that is infected with HIV? And if you're heterosexual, have you had more than one partner since the last office visit is usually what they'll ask. And they don't use the word promiscuous. And I would strongly encourage you as a nurse not to use the word promiscuous. And, you know, I'll give 5 extra credit points to anyone that can spell it first on my little screen over here. Looking for it, looking for it, looking for it. Who was it? Megan Johnson, Permeus. I love it. Okay. We'll just wait for that all to happen. Okay. All right. So how do we diagnose somebody that has HIV? So first of all, there's an oral quick rapid HIV test, very similar to the RONAC test that they do right now, except they don't stick it in your nose, they stick it in your mouth. They can also do a finger stick blood test, and they can also do a urine test. And those are just precursors. If it comes back positive, you need to go back in and get more tests done. They also use what they call a multi-spot HIV-1, HIV-2 rapid test. And this is an antibody test, which literally can be, the results can be made available within 20 minutes. And it is 99% accurate. Now, they'll use this kind of test out in the homeless community for people that are using drugs, doing a lot of needle work on their arms and in between their toes, where they go out to the community and seek out people that may be infected. But again, with either one of these, an additional confirmatory test is required. So the way you diagnose is that you have a complete blood cell count and a lymphocyte count. And again, we're looking specifically at CD4 T cells. And again, that we indicated that that's lower than normal. And then if you do have less than 200 cells per cubic millimeter, you're going to be diagnosed with AIDS if you have an opportunistic infection. Okay, so how do we go in and suspect that we may have AIDS? So we have the diagnosis here, and again, people may not recognize that, oh, if you need breaks, Vicki, please take them. I don't want you to make yourself feel worse with the Rona. Aren't you so sweet? I appreciate that. What time is it? Okay, let's do this one, and then we will take a 10-minute break. So, I totally lost my train of thought. Okay, so we want an increased risk for infections here. We don't want one. It's just that when your T cell count gets low, then you are going to be at greater risk for infections. And we talked about pathogenic infections. So let's just say that you're one of the lucky few in the world that had a good date Friday night and you had a little celebratory sex afterwards, that it was so good. And the thing is that you may start seeing that you have frequent pathogenic infections. So let's start thinking that you may have a yeast infection. Yeah. Oh, aren't those fun? Yeah. Do they happen after sex? Yeah. As a matter of fact, they do. So let's say you have an yeast infection. You go to the doctor, get a little monostat, or maybe you don't even go to the doctor. You just go over the counter, get a little monostat, take care of it. And then it comes back. And then it comes back again and again and again. So you have something that would be a normal infection according, just something that you've had before, UTI, something, but it keeps recurring. So you just can't seem to get rid of it like you used to be able to do that. So that is something that you may first begin to notice. So if by chance you do have frequent or multiple sex partners, and you start noticing yourself that you're having frequent UTIs or frequent infections, and the normal way that you've already taken care of them is not taking care of them anymore, then you may start questioning whether or not you need to go in and get screened. But as your CD4 T cell count gets lower and lower, you're going to start acquiring opportunistic infections. This is where these pathogens rarely cause harm in healthy individuals with healthy immune systems, but you don't have the immune system to fight this off anymore. So you become what they call, they move you into age, which is acquired immune deficiency syndrome, because the infection has now taken over your system. So there are 20 different conditions that are specifically associated with AIDS, and we're going to talk about some of these disease processes coming up. But let's take a break. So it's 10:52. Let's come back at 11. Okay, sounds good to me. All right, see you back in 8 minutes. What you were going to tell me to do. Sorry, I forgot to record. So we're back looking at these clinical manifestations or CD4 T cell counts. So when you have over 200,000 but less than 500,000 of the CD4 T cells, this is when you're going to start getting the oral candidiasis and the Kaposi sarcoma. And we're going to go over these in just a minute, so you'll see a little bit more in depth what they are. Okay, I just got a text from Jody. All right, so if you have less than 200 and 100,000 or 100 per cubic millimeter, then you're going to develop pneumocystitis pneumonia, or you can have progressive multifocal leukoencephalopathy. So it gets worse the less CD4 T cells you get. And then if you have 50 to 100 CD4 T cells counts. Then you have toxoplasmosis, cryptosporidiosis, and cytomegalovirus. Say that real fast when you're drinking. All right, and then if you have less than 50, then you're going to get that Mycobacterium avium complex, which is really, really, that's end-stage AIDS that you're looking at. So let's look at these disease processes a little bit more. So really, when you develop pneumocystis pneumonia or TB, then what it's going to show here is that you have less than 200,000 per milliliter of blood, or less than 100,000, or 200 per cubic millimeter, or 100 per cubic millimeter of CD4 T cell counts. Then you become very susceptible to the pneumocystis pneumonia. So if you see somebody that has that as a diagnosis, then you know that that's pretty much somebody that's got HIV, because most of the population does not develop that right now. You may also, if somebody, people with that low of a T cell count will also become highly susceptible to TB. And that is actually the leading cause of death for people that have HIV worldwide, is the TB that gets them. So with pneumocystis pneumonia, there's going to be some very non-specific symptoms. So there's going to be a non-productive cough. How many of you have had that? If you've had COVID, have you had that? Yeah, I've had it. But what differentiates pneumocystis pneumonia is that you usually have a very high fever and chills that are associated with this. And of course, because there is pneumonia involved and a lack of gas exchange, and there's going to be shortness of breath and dyspnea. And so it may take weeks, it may take months to diagnose. Why? Because your healthcare provider hasn't screened you. When was the last time any one of you got screened for HIV? I don't think, I'm 67 years old and I haven't been screened my whole life for HIV. It's because one person takes a look at me and says, she ain't having sex. That's a fact, Jack. But the thing about it is that the healthcare provider doesn't know you have multiple sex partners. And so they go in, they see that you have this frequent pneumonia going on. They check to see if you have bacterial pneumonia, viral pneumonia, their usual pathogens that they're looking for comes back negative. They don't really know. But when it continues and persists for months on end, then they may start testing for the pneumocystis pneumonia, and it can be determined then. Maybe that's the first time that you will be diagnosed with having HIV. So tuberculosis can literally be found in the lungs and the extrapulmonary sites, and it can be found in different parts of the body. And it can is spread through airborne particles. We know you need to be in a negative room, pressured room. Anybody familiar with that? Anybody experienced that as a CNA working with COVID patients? And again, symptoms may include fever, night sweats. This is what's going to differentiate this. If you're looking at signs and symptoms, the night sweats are going to differentiate TB from the pneumocystis pneumonia. Cough, weight loss, pleuritic pain. Very difficult to get around. Very highly contagious as well. Okay, so then we talked about when you have CD4 T cell count less than 50 per cubic millimeter, then you're going to be susceptible for having this gastrointestinal manifestation of Mycobacterium avium complex. It's called MAC. And oh my gosh, it is just, you can't absorb anything. This is the inside of the intestine here. Nothing gets absorbed. So it is just, you're wasting away to nothing. you have a chronic fever, you have anemia, weight loss, diarrhea, abdominal pain, night sweats, malaise. It's very, very, very sick. You're just sick all the time. And you really do end up with this wasting syndrome. And this is where your weight loss exceeds 10% of your baseline body weight with chronic diarrhea for more than 30 days. And so you're going to end up with this malabsorption, and then it's just down to where, and when you're so malnourished because of that, then death comes pretty quickly after that. So another infection that is very common with people that have HIV is oral candidiasis. And this is where you have these creamy white patches in the oral cavity. So if I were to describe to you on a test question, patient has oral white patch or creamy white patches in the oral cavity, then you've got to think oral candidiasis here. And think of thrush is another term for this. But what is so painful about this is that these are very, very painful. They travel, and these patches go to the back of the throat and down the esophagus. So eating is extremely painful. So then people don't eat. They don't want to swallow. They don't want to do anything. It's very painful for them. They have heartburn, and they'll have lesions on there, these that hurt like cankers. It's very, very painful. And again, they're going to suffer some malnutrition there because of their lack of eating. So gynecologically, people will have vaginal candidiasis there, genital warts, HPV, pelvic inflammatory disease. So patients that have STDs are at a higher risk for contracting AIDS and HIV because of these open lesions that have come with the STD. Okay, Kaposi's sarcoma. So look at this. Oh my gosh. How many of us get all upset when we wake up in the morning and we have to get on big blue button here, and there's a camera there that shows a huge new zit right here on our nose, right here. And we get all upset about that. And we're very self-conscious about it. We try and cover it up with makeup or something. Well, Kaposi's sarcoma is a vascular malignancy. So you have these growths, and it usually starts with the face, but it can be anywhere on the body, and it can be in the internal organs as well. And they're this brownish or deep purple on the face. It can be flat, or they can be surrounded by bruising. But again, can you imagine the disfigurement? Can you imagine the shame? Can you imagine, I just think of, being shouted from the rooftops. Anybody that sees this knows the person has AIDS because nobody else gets it except people with AIDS. And so it's just, can you imagine the psychological impact HIV and AIDS has on the individual that is starting to exhibit some of these opportunistic infections? So non-Hodgkin's lymphomas, again, you're looking at high fever, night sweats, weight loss. The thing about it is that if this cancer moves up into the brain, you're going to start having some CNS involvement where the person may be showing signs of dementia. There can be cervical and anal cancers, and you can see that these are 40 to 80 times higher in people that have HIV. Why? Because there's no immune system there to fight it off or to help heal once it's there. And then again, peripheral neuropathy is going to occur. And then when you have a neurological manifestation or of an opportunistic infection, you're going to be looking at encephalopathy here. And it may be very subtle at first. Usually by the time that people start developing these signs and symptoms, Then they have been diagnosed. They've been experiencing other signs and symptoms of opportunistic infections. So they're going to have poor concentration and forgetfulness, and loss of balance. They'll have leg weakness, apathy. And again, you can understand the social withdrawal because they don't really understand over here what's happening or why. Or if they have a partner, their partner wants to protect them somewhat. With advanced systems, they can get into very psychotic behavior, and then they can go into a catatonic state where they just kind of stare at the wall. But you see a lot of that with other neurological disease processes, but this is specific to HIV and AIDS. So when you have I've got to pull up my other computer here. See what it was exactly that I wanted to say about this. Okay, so what you can't see up here, the title here is Depression and Social Isolation Associated with AIDS. Oh my gosh, people. You know, this is where my heart breaks. This is where my heart breaks because of the isolation that these people feel. You know, back in the 80s, they were condemned. They were morally judged. They were, it's your own fault. You shouldn't have been doing that. You know, this is God's punishment on you. There was such a moral judgment on anybody that had HIV or AIDS. And it was a bad time, I've got to say. The whole heterosexual community came down on the homosexual community. They just didn't cut them any slack at all. And it was very, very difficult for these people to be out in public. And so there was a huge problem also associated with the fact that these people were, when they got HIV, it was pretty much a death diagnosis because it would automatically go into AIDS because there wasn't any cure for it at that time. And they could just expect a horrible death, just a wasting away and a horrible death. And it's just heartbreaking. Thank goodness the research has been done to make the advanced medications to keep death at bay and to prevent the progression of the disease process, and to help people make wiser decisions because of the education that has come with that. That being said, that's what it's like here in America. But in Africa, you know, there is still this disdain, this exclusion of people that are sick because usually they're at home. They don't have access to health care. And so they digress at home and sometimes alone. So the psychological and depression that accompanying this disease is totally dependent on the person's support system and who and what they have available. I put this in here just because you need to be aware of shingles. Shingles is a virus that the person becomes very susceptible to. But what I wanted you to notice about shingles, and it's a viral infection, but notice how the blisters or the lesions that appear only go to the midline of the body. So if you start here and you have these lesions that follow the nerve pathways, and that's why they're so very painful, because these lesions just inflame the nerves. So they're very painful. But notice they only go to the midline of the body. Now they may have another one over here that ends up the same place, but they never cross the midline, which I think is very interesting for shingle lesions. All right, so what is the treatment for HIV? First of all, they have a multi-cocktail now. They have a cocktail for it. Used to be 3 drugs that you would take daily. Now it's down to 2. It's not a cure, but it helps to maintain the body's immune system for a long time. It's critical that these drugs are not missed. There is no delay in taking them, or that because of the expense of them, that they are administered in a lower than prescribed dose. And those drugs have many side effects, but the antiretroviral therapy is based on the CD4 T cell count, which is considered the viral load. Do not get viral load confused with the CD4 T cell count. The TC4, that did not make sense at all. The CD4 T cell count is a result of the viral load. How much HIV viruses have consumed the working T cells in the immune system. So the viral load, how heavy that is, will affect what the CD4 T cell count is. That makes sense to everybody? Okay, moving on. All right, so your viral load refers to the amount of HIV in a sample of your blood. A goal of HIV treatment is to decrease your viral load and increase your CD4 T cell count. And you still have to stay on the treatment if you have an undetectable viral load. That would be optimum if you had an undetectable viral load, but that doesn't mean you can quit taking the medication. So patient family education, and see how many of these are familiar with COVID. Avoid crowds, do not share personal toiletry items, please don't. Bathe daily, clean toothbrush, wash hands, eat a low bacteria diet, wash dishes well, do not drink water, milk, juice, or other cold liquids that have been standing for longer than an hour. Avoid changing pet litter boxes. Avoid turtles and reptiles as pet. Take your temperature at least once a day. Report any symptoms of infection to the physician immediately. Take all prescribed drugs. Do not dig in the garden or work with house plants because of bacteria that is found there. Use a condom when having sex, and avoid travel to areas of the world with poor sanitation. And then these are, infection control precautions for the immunosuppressed patient that is in the hospital. So you should know these by now. This is a good refresher for your final exam, because these immunosuppressed precautions are used for anybody that is on cancer therapy or anything that has caused a person to be immunosuppressed. So if HIV is transmitted to healthcare workers, if you looked at the slide much earlier in this session, you'll see that it's very rare, because healthcare workers are very meticulous, are taught in nursing school from day one. about infection control measures and how to prevent transmission. And that's why so many, you see the one hand scoop method to recapping needles. You'll see them throwing away into a sharps container immediately. And how universal precautions have become standardized for every patient, whether they have HIV or not. And then here, wear gloves at all times. You know these. You know those, you know those, you know those. Post-exposure prophylaxis for occupational HIV exposure. Then you do need to wash contaminated area immediately. Evaluate by your physician. Usually you'll go to the employee health area, and you'll get blood work taken. The person that you got this finger stick from, if you had a contaminated needle stick you, then they will be asked if they can have their blood drawn to see if they have HIV. Usually the patients are pretty good about that. So PEP is your post-exposure, and you have to take this within 72 hours after being exposed. So it stops the virus from replicating, and it depends on the severity of the exposure. So you take this drug for 28 days. There's 2 drugs there, and then if you have to go a little bit longer than 2 days, you can take 3 drugs. It has to be taken within 72 hours of the exposure, and you can get that from your local doctor's office. Woo! Are we finished yet? No, we are not. Why? Because we're waiting for the Mark Medina's presentation. Let me pull it up here for you, Mark. There we go. Let's see if I can bring this over here, how we can do this. Just a minute. Hold on. It's the application window, and I'm going to bring, where'd you go, Mark? Tell me I just lost you. Right, lost you again. Come back, Mark. There we go. Let's see if it works. There we go. Come back.
All right, cool. Thanks, Vicky.
Do you see it?
Yeah, I see it.
Okay.
Does everybody else see it?
I'll hit it as I go.
All right, so I got community resources for patients with HIV. Next slide, please.
Yeah, we're working on it. Working on it. See, it's a PDF, and I have a problem with PDFs. I'm not real sure how. Come down. Wait a minute. Hold it.
That was my bad. I thought it was probably going to be easier if I sent it in PDF. But...
Can you take over the screen?
I don't think so.
Okay, just a minute. Let me bring it up again.
Hey, Vicky.
Okay.
Oh, there you
Yeah.
go. I was
Okay,
just
go
gonna say,
ahead.
there's arrows up by the numbers. See how it says 2 out of 10? There's arrows that you can click that.
Oh, okay, good. All right, I'll do that.
All right, we can try that. So the Ryan White HIV/AIDS program is like the #1 program in the U.S. that provides like medical care and support services and medications for people living with HIV. So they basically serve people who are uninsured, low income, and it just funds like basically every state and local community organizations. And the most important part that I read about this program was that like over half the people living with diagnosed HIV in the United States receive assistance through this program. So I thought that was pretty interesting. So why did they call it after Ryan White? Like Vicky was kind of saying back in the 80s, this kid was only 13 years old and he got AIDS because of a blood transfusion. And because of that, he was only given like 6 months to live, but ended up living like 5 years. And during that time period, he was wanting to like return to school, like high school and stuff. But like Vicky was saying, a lot of people were like saying he was doing sinful things and stuff, but like he just got a blood transfusion, and like I feel like that's just a normal medical procedure. And yeah, people were like discriminating against him and thinking that it was gonna spread, and like the government made named the program after him because of just what happened to him and stuff. So the next uh government program they have is housing opportunities for persons with AIDS. And like the majority of these programs are basically for low income people and people below the medium income. So it basically just gives people places to stay at public housing and stuff like that in the really metropolitan areas, like the big city areas like New York, Atlanta, LA, stuff like that. And they said that their funding is based on the amount of cases per state. So basically, like areas that have more than 2,000 cases of HIV or AIDS get the most funding. So this was pretty interesting for me. I did not know that the people with HIV qualified under the Americans with Disability Act, and so I thought that was pretty interesting. So under this program, you can request special accommodations, meaning not all HIV patients will need them, but like you can just say like, oh, if you have to meet with the doctor a lot, then you can request a certain schedule and stuff like that to meet those needs compared to regular people. And what I thought was also interesting is that people who are seen as having HIV but don't have it. So like if it's rumored that they have HIV, they're also protected under this law for the American Disabilities Act. So that was interesting. Another kind of program they have is business response to AIDS. It's just like a public-private partnership through the CDC that supports education and stuff for small, medium, and large businesses. Their goals mainly are to increase HIV awareness among the workforce, strengthen workplace-based testing, and then prevention and treatment services, and just give more responsibility to the business in trying to like bring awareness to HIV and what it does. There's some other resources I found here, not enough to cover a whole entire slide, but so there's an HIV STI hotline in every state, according to the CDC, and I just looked up the list and I found Utah, so I decided to put it in here. So I thought that was pretty cool. Another good thing to know is the Travelers Health for Immunocompromised Travelers. So the CDC has a book or like a yellow book in which they, depending on, you can just like look up where you're gonna go travel and it'll come up with a whole bunch of like travel recommendations and like vaccinations to get before you even get there. And so that's super helpful and I thought that was way cool. And then the Travelers Health page, which is pretty similar. They also do very similar things and just locate local clinics in that area that could help with your HIV diagnosis. So as a learning activity, I just did like a short little like 2-question quiz here at the end, so you guys could like write in the chat what the right answer was to the question. That'd be super helpful. So the question is, the majority of persons with AIDS take part of what program? And if everybody can put in what they think it is, that'd be nice. All right, looks like everybody's putting in D, and D is the right answer. That's right.
Are you still there, Mark?
Yeah. People. Oh, I didn't even notice that he switched. Whatever slides, because like they all look the same to me. But people with HIV/AIDS can receive special accommodations at work as a result of what government program, and everybody's putting in C, and C is the right answer. Thank you guys for listening to me, and thank you, Vicky.
And thank you, Mark. What a good finish to our little lecture on HIV. Okay, here's the deal. Tomorrow is quiz day, so don't forget your little quiz tomorrow that we'll have at the very beginning for 15 minutes, and then we'll finish up with cancer. Now, tomorrow I want all of you to have your little iPhones ready, or your cell phones, and have your little light, because we're going to close out in style. Because why? Because we're Davis Tech students. That's why. And so we're going to do that tomorrow at the very, very end. And then, bam, you are done, people. You are done. So hang in there. Hang in there. I see the light at the end of the tunnel. You? I do. Yes, it is. It's going to be close. So hang in there. I'll see you tomorrow. And 8 a.m., be there, be square. All right. Love you guys. See you. Bye.